Hi, I did my project on the Affordable Care Act, otherwise known as Obamacare. And upon my research, I asked myself the question, why did I choose this topic? And I chose this topic because this Affordable Care Act has truly impacted myself and my family. And I chose this topic because I believe that it is important that Americans are covered financially by a universal health care program. I believe that every American deserves the right to stay healthy. And towards the end of my research, I was looking forward to learning what was so interesting about the Affordable Care Act, what it is, what aspects are made of the Affordable Care Act, and how it will affect Americans becoming insured in health-related expenses, such as testing and various hospital visits. What exactly is the Affordable Care Act? Well, the Affordable Care Act is a health law that affected 16 million Americans in order to provide health coverage for the uninsured. And it also protects consumers from abusive insurance company practices, because many insurance companies would take advantage of consumers that are actually uninsured. And there are many advances in Medicare and Medicaid, which are government-funded programs for 65 and over and the low-income people. The Affordable Care Act was a bill that was signed in 2010 by the Obama administration, and there was a big political headwind that came across it between Republicans and Democrats, but the Patient Protection and Affordable Care Act was signed into law as the Affordable Care Act, otherwise known as the Obamacare Act. And it actually provides care to the uninsured and mostly targets the low income and disabled. And it also lowers the cost and improves quality of care. How does the Affordable Care Act affect you and I? It provides coverage to those with pre-existing health conditions. This means people who have illnesses or diseases like diabetes, strep throat, cancer, you name it. Any conflicting illness, it won't deny coverage to those people. And it provides certain protection and rights to allow your coverage to be understandable, because the Affordable Care Act can become extremely complex. So this sort of has a way of simplifying that and provides a healthcare marketplace where consumers like you and I can buy into this Affordable Care Act, where it offers various plans that you can actually purchase, whether it be through your employer or individually. And it holds insurance companies liable. Insurance companies liable in a way where they are responsible for your health. Benefits. People who benefit from Medicaid will actually receive a benchmark package that will provide exchanges. And this will also provide extensions of funding for CHIP, which is a government-run program just like Medicare and Medicaid, but this program is unique in a way where children are not dropped until the age of 26, meaning that children can be on their insurance plans of their parents until they are 26 years of age. And care plan improvements with insurance companies. And if insurance companies don't meet the standards that are made by policymakers like CMS, they have to provide consumers with rebates. Where can you access these plans? These plans are actually accessed through the healthcare marketplace on healthcare.gov, where you can purchase these health plans. And they vary from premium, gold, all different types of plans of what they offer. Insurance companies vary, and they're accessible by employees and or personal income. The outcomes of these plans is the improvement of healthcare quality, prevents constant hospital visits, ensures patient safety, reduces medical errors, and lowers cost of care. The pros are that low-income families benefit from Medicaid, children with pre-existing conditions are covered, private insurers keep premium at a low, and states will save money in these hidden costs. And the affordable coverage, if insurance companies don't use at least 80% of your premium dollar on medical expenses, they will actually give you your premium back and actually improve your quality of care. So these insurance companies are really held at ransom to meet the standards that are needed for great patient outcome. Millions of Americans who can't get insurance from their employers are actually getting financial assistance, which can help to lower their monthly premiums. Consumer rights and protections. In the past, as I previously stated, cancer patients were refused care due to chronic conditions. Insurance companies would deny them because their cost of care would be far too expensive. And insurance companies can no longer deny you due to a mistake on your application. For instance, these insurance companies would really have a goal set to deny you if there was a mistake or the slightest of illness. They would just automatically deny you coverage of care. These Medicare advantages, it lowers the medication costs for the elderly, and these are recommended preventative services that come under the ACA. Flu shots, diabetes screenings, and annual wellness care visits. These are all actually under the Affordable Care Act as free of cost or of a low charge. The cons are that private insurers were dropping consumers from their coverage. As I previously stated, these insurance companies were held at ransom to provide you with quality care, regardless of any pre-existing conditions. Well, unfortunately, when this theoretical idea was actually put into play, consumers were being dropped from their current insurance company, and they were prompted to call a 1-800 number upon accessing care from the healthcare.gov website. There was a surge of Americans who were trying to access this 1-800 number, and they've improved now, but then it was very difficult to access. And millions of Americans were actually without private insurance due to their previous private insurers dropping them because of Obamacare. Quality improvement. Each health plan is measured by a series of standards that are met by these policymakers. And CMS requires that health plans be involved in Medicare Advantages in order to report any problems that are happening within hospitalization. And health plans manage to accommodate convenient care for consumers and benefit designs with higher ratings. This is where hospitals have a survey where consumers are taking these surveys to see how each health facility is being rated. So this would actually help to improve quality of care. And final thoughts, the Affordable Care Act is slowly revolutionizing the way that Americans are covered in the healthcare industry. Medicare and Medicaid expansions have impacted millions of low-income Americans and those who are 65 and over. And as a nation, we have improved in healthcare, in the healthcare industry, but we have a far way to go on the global stage. Whereas many other foreign nations have cut costs but really have improved the quality of care, where Americans have used high costs but lowered their quality of care. And a lot of foreign nations actually have the idea that us gaining affordable care, like a universal health care, would potentially cause an anarchy or a disrupt of our nation. But that is my presentation, and thank you for watching.